sickness. Altitude sickness is a blanket term that covers a variety of ailments that includes acute mountain sickness, high altitude cerebral edema, and high altitude pulmonary edema. All of them are potentially life-threatening and are generally brought on by ascending to high altitudes too quickly or remaining at extreme altitudes for too long. As a trek leader and as a high altitude climber, I've experienced almost all of these symptoms either first or second hand, and this video is not only just about giving you the symptoms but also giving you some context as well. Now, because the symptoms are so many and so varied, I'll be breaking them down into 3 categories so you fully understand their severity and their implications. Keep in mind, I'm not a doctor and I'm not giving you medical advice here. This is just a system that I've developed for me personally as a climber to help me make smarter decisions about whether I go up or turn around. I suggest you do your own research and consult your own medical professional. So this first category of symptoms is what I consider to be a fairly common, very normal reaction to being at high altitude. And the symptoms resemble that of a hangover. A headache is perhaps the most common symptom of altitude sickness, and honestly, if you're above 2,500 meters for more than a day or so, you'll probably get a headache. It may come and go, but it usually subsides after a few days. Now, along with a headache, we have what I call category 1 symptoms. They also include being slightly out of breath when active, having difficulty sleeping, and having a higher than normal heart rate. Now, if you don't know what your normal heart rate is, either at rest or at exercise, we have an excellent free fitness test that you can do where you can determine what both your resting and active heart rates are. This is a great thing to be doing before you go on a trek or a climb, and I highly recommend you do it. Visit the link in the description below that says trekking fitness test. So you're at altitude and you're experiencing one of these symptoms like a headache. Don't freak out, it's very, very normal. You might even just be dehydrated. Usually what I do is drink a litre of water and see if the headache subsides. If it doesn't relieve the headache, I take a paracetamol and accept the fact that I have mild AMS. This happens to me almost every time. Just a quick note here, I'm not covering my approach to Diamox and other altitude medications in this video. It'd take far too long. I do plan to do it in another video coming up soon. So hit subscribe and I'll let you know when it's up. So the headache and these other category 1 symptoms I consider to be annoying but also acceptable, and I'll almost always continue trekking and climbing whilst experiencing them. I don't consider them to be life-threatening, and they kind of just become part of everyday life for me when I'm in the mountains. Where I draw the line though is this second category of symptoms. I consider them all to be potentially life-threatening, and I don't ascend if I'm experiencing them. If the symptoms are mild, I'll tend to stay an extra night at the altitude that I currently am to see if they have subsided by the morning, and if they don't, I would be heading down. However, they almost always do. My category 2 symptoms include loss of appetite, nausea, weakness, dizziness or lightheadedness, and ongoing fatigue. Now, a side note with that last one, fatigue. It really helps to be training regularly and at a high intensity so you fully understand your acceptable fatigue limits. Otherwise, how would you know if you had AMS or you were just unfit? There's a link in the description below to our introductory fitness program specific for trekking. You should start today. Now, this second category differs from the first in that they have a negative impact on my ability to trek or climb safely. For example, I would consider it potentially life-threatening to walk or certainly climb past something like this whilst experiencing dizziness or lightheadedness, wouldn't you? I can't say the same about having a mild headache or having a higher than normal heart rate though, so you can start to see where I draw the line here. Category 3, now shit gets real. Category 3 is what I call the helicopter category, because getting a helicopter down the mountain is by far the best cure for anyone experiencing these category 3 symptoms. Under no circumstances would I ascend while experiencing them, and I certainly wouldn't let anyone I cared about or anyone I had control over ascend or even stay at the same altitude whilst experiencing them. These are immediately life-threatening, and the only way to treat them is with rapid descent. Now, a lot of the time, people experiencing these symptoms are going to be incapable of rapid descent on their own, in which case your best option is to get that person down in a helicopter. Now, experiencing any of these category 3 symptoms at high altitude would generally indicate that the individual is suffering from either HAPE or HACE. These are both extreme forms of altitude sickness that I'm going to gloss over here for the sake of brevity. Let's start with HAPE. That stands for high altitude pulmonary edema and is essentially a fancy way of saying fluid on the lungs. All you need to know is that it's bad, real bad, and anyone experiencing this needs to descend without delay. Picture it like drowning in the fluid that's collecting in your own lungs. Not so good. Category 3 symptoms commonly attributed to HAPE include but are not limited to any change in normal behaviour, shortness of breath at rest, wheezing or gasping for breath upon exercise, tightness or congestion in the chest, abnormal sounds when breathing, especially gurgling, confusion and slurred speech, cold, clammy skin, a feeling of suffocating or drowning that worsens when lying down, a cough that produces frothy sputum that may be tinged with blood. Okay, they're the symptoms commonly attributed to HAPE. Now we're going to talk about HACE. HACE stands for high altitude cerebral edema, and again, it's a fancy way of saying fluid on the brain. This is essentially an advanced form of acute mountain sickness with those hangover-like symptoms that we talked about earlier. As you can imagine, fluid on the brain isn't a good thing either, and again, you don't really need to understand why it happens, you just need to be able to recognize the symptoms and know that it's bad. Category 3 symptoms commonly attributed to high altitude cerebral edema include, but are not limited to, severe headache that is not relieved by medicines, any change in normal behaviour, confusion, visions and delusions, nausea and vomiting, loss of coordination, sensitivity to light, extreme fatigue, inability to sit up or move, stumbling and eventually the inability to walk, talk or move, having a grey, pale or bluish skin tone. Now these are some of the symptoms that have been recorded as a result of HAPE or HACE. I'm sure there are many others, but these are the most common ones. Many of these symptoms are interchangeable between HAPE and HACE, and under the worst circumstances, trekkers or climbers could be experiencing both HAPE and HACE at the same time. The thing to point out here that I think is important is that if you're experiencing these symptoms, you're probably not going to be aware of it. It kind of sneaks up on you. That's why I think it's really, really important that that your trekking or mountain guide or your climbing partner tells you you need to go down immediately, then you should follow their advice. And B, it's important that everyone going to altitude knows and understands these symptoms and is able to recognize them in someone else to be able to help them out when they need it. And what I'm trying to say here is share this video, please, not only for the benefit of my YouTube channel, but also to get this information out there. Before I wrap this up, I want to highlight one symptom in particular. It's often the most subtle, but very, very important, and that is any change in normal behavior. I've seen people's personalities change overnight when experiencing HACE. For example, someone who is usually bright, fun, and talkative might be unusually grumpy, they might avoid eye contact, and they might seem overly tired. They might say weird things or have a strange look in their eye. They might talk a lot less than usual and generally act like a drunken homeless guy. Yet another reason not to drink alcohol at altitude. People might mistake you for having HACE when you're actually just drunk, which